The last question in osteology, which is very important here, is the blood supply of a long bone. So what are you going to write about the blood supply of a long bone? First of all, you mention about which all are the parts there. Okay, then you would have to say about the 4 important groups of blood vessels. Okay, so the first one, when you are learning any bone, you would have learned that there is something entering into the shaft in a particular direction. That is your, what is it? Nutrient artery. Now, if I am drawing the nutrient artery, we know it enters into the shaft at an angle, and as it is entering, it has a tortuosity just before it's going to enter. Why? When I'm going to move our limbs, if this had no tortuosity, it was just attached here, when I suddenly stretch, while I'm yawning, suddenly my nutrient artery will just snap off. Okay, so to accommodate the movements of these bones, you have a small tortuosity of the nutrient artery as it enters. Once it enters in through the periosteum, enters into the through the compact bone into the medullary cavity, it gives off a branch above, a branch below. So this is one group of arteries. The first group, that is the nutrient artery. Okay, nutrient artery. There is something important about the nutrient artery, the direction of nutrient artery, which you should remember, which I'll tell you in the end. So this is one group. The second group, that would be the second group. You have seen that the shaft is almost supplied by the nutrient artery. So then you have to have arteries going to the ends. Okay, so that means you will have something called as a epiphyseal artery. Okay, so this is your epiphyseal artery going to the ends. Okay, epiphyseal artery supplies the ends of the long bone, or the epiphysis. Now you have to have also the junction, at this area of the metaphysis also you should have some blood supply. Why? Because this epiphyseal plate and the metaphysis, this is the area where maximum bone growth is going to occur. Okay, so where you have lot of growth, you need lot of food. Okay, so this area here is supplied by something called as metaphyseal artery. So this is supplying the metaphysis and the epiphyseal plate there. You call this metaphyseal artery also as juxta epiphyseal artery. Okay, just remember that some textbooks have given it like that. They have not written metaphyseal artery. Instead of that, they have written it as juxta epiphyseal artery. So that is the third group of artery. Now, what is the fourth group of arteries? We saw that the ends are supplied, the metaphysis is supplied, the diaphysis is supplied. Now, you should also remember that the nutrient artery, it is going to supply, what all will it supply? The medullary cavity with the bone marrow there, and it's also going to supply the inner two-third of the compact bone. We said that there is compact bone in the wall here. Okay, compact bone. Okay, so the inner two-third is supplied by the artery. Okay, it will supply this inner two-third. How about the outer one-third? Outer one-third, this area. Okay, this area will be supplied by the, it's passing through the periosteum and going, so you have the periosteal artery. Steal artery. So these are the arteries that you should know, the blood supply of the bone, long bone. An important thing here is that after mentioning all these 4 groups, that is a nutrient artery, epiphyseal, metaphyseal or juxtaepiphyseal and periosteal arteries, you should say that there is anastomosis occurring in this area. Okay, and there are something called as hairpin bends here. You have hairpin bends here. The ends of the nutrient artery is going to form a kind of hairpin appearance there. Okay, so as to supply more blood to this area, because we said that this is an area of maximum bone growth. Since lot of blood comes here, lot of activity is occurring there, this is also a place where microbes could also enter through the blood and reach here. So it is also an area where infection of bones are quite common. That is how it is clinically important. The metaphysis is an area where infections are quite common. Okay.